Alright. Okay, for neck mass kita skip part anatomy. Nanti anatomy ni macam ni ya. Okay, yang penting apa the purpose of today, just nak make sure you guys faham the common neck mass and then macam mana dia punya epidemiology in children yang ada kan, history taking and then kita akan tengok central versus lateral mass, and then ada sikit on abscess at the end. Okay. Alright. Okay, so for age in children, mass, bila kita sebut pasal neck mass, Syafiq dah start record semua kan?
Dah.
Okay, so bila sebut pasal mass, central, kita boleh bagi neck mass kepada central dengan lateral lah. Maknanya midline dengan lateral kan. Lepas tu age tu pula, kita boleh bagi dia kepada inflammatory dengan non-inflammatory. Okay, so in children, the commonly, mana? Yes, okay. So in children, the commonly inflammatory, congenital and occasionally neoplastic. Okay. In children less than 15, 90% is non-thyroid mass ataupun benign. 55% may be congenital then inflammatory swelling. Okay. One also should consider lymphoma as an uncommon but extremely important diagnosis. So ini kita compare lah between child 0 to 15, young adult 16 to 35, and then adult 35 years plus. So congenital, of course, the more common in child, cystic hygroma, thyroglossal duct cyst, and then young adult cyst. So adult very very uncommon. Okay. So again, child very common inflammatory. Okay. And then salivary disease pun usually inflammatory. Okay. Okay, kalau macam adult, usually the more common neoplasm lah, lymphoma, squamous cell carcinoma, metastasis. Okay, tak apa. And then also thyroid, endocrine thyroid malignancy. Right, so right. Okay, so adult. Kalau adult, the first consideration in the adult mass is neoplastic. So, kalau lateral neck mass especially, lateral neck lump, even cystic pun, malignant unless proven otherwise. So, kita guna the rule of 80. Okay? The rule of 80 ni, basically kita nak cakap 80% of cervical lymphadenopathy are neoplastic. 80% also adalah from metastasis. Okay? And then 80% arises above the clavicle. Primary side dia above the clavicle. Okay, so 80% neoplastic, 80% are metastasis, and then 80% are above clavicle. Ni samalah ni. 80% on non-thyroid neck mass are probably neoplastic. Ni sama, ni ulang balik je. Okay, tak apa. So 80% are malignant, 80% are metastatic, and 80% arrive above the clavicle side. Okay, so in history taking, usually ni basically the disease and what are the corresponding dia punya history lah. So kalau kita dapat patient yang history macam ni, kita boleh think of this disease. Okay, kalau macam inflammatory disorder, usually patient cakap dia acute dan resolve 2 to 6 weeks. Tu kalau inflammatory disorder. Ni common in children Okay, kalau sore throat or URTI, inflammatory cervical lymphadenopathy. Okay. The congenital mass usually presents its burst as a small asymptotic mass which enlarge after a mild URTI. Tapi kan, congenital mass ni dia also can macam masa child tak ada pun, tapi yang adult nanti ada. Nanti ada satu mass tu nanti dia macam tu, nanti sabar. Okay, so metastatic carcinoma, they short history with progressive enlargement. Ni usually common 35 years old and above in adult. Okay. And then transient postprandial swelling in the submandibular parietal area. Ini salivary duct obstruction. Okay, dia also can be submandibular ataupun parietal abscess lah. Tak apa. Okay, so bilateral diffuse tender parietal enlargement ni suggestive of parotitis, more commonly mumps. Okay. Okay, apalah ni macam tak penting sangat ni. That's alright. Exposure of TV ni penting juga ni nanti. Nanti ni more kepada retropharyngeal abscess. Okay, tak apa. That's alright. Nanti kita go through. So location ni quite important, tapi saya rasa ini kena baca sendirilah. Dia just nak cakap macam kalau dekat part ni apa corresponding disease lah, macam kat neck ni in occipital triangle dia ada inflammatory, dia ada neoplastic, dia ada metastatic kalau kat lymph node lah kan. And then ni you guys kena baca sendirilah punya metastasis pada mana. Kalau dekat supraclavicular triangle nampak dia can be from breast, lung, GI tract, kidney, blah blah blah, alright. Tak ada apalah. Okay. So for examination, congenital masses usually the soft, smooth dengan mobile. Kalau high suspicion of inflammatory adenopathy, the tender mobile mass, and then the broad spectrum antibiotic 2 weeks. So kalau chronic inflammatory masses and lymphoma, the non-tender, rubbery and mobile. And then in older age patient, sometimes the mass can be not actually from malignancy lah, the from dia punya gland. So submandibular dengan parotid gland dia maybe and mimic a neck mass. Maknanya dia sebenarnya tak ada masalah pun lah. So that can also be possible. Cuma of course it is a malignancy until proven otherwise, especially kalau lateral neck mass lah kan. Okay. More than 2 cm in diameter, if more than 35 years old, not regularly seen, kita kena consider the malignancy until proven otherwise. Okay. Endoscopic assessment of the nasal cavity finding analytics, especially in mucosal surfaces, sebab kita takut malignancy. Okay. So in child, okay, reactive viral lymphadenopathy ni is the most common cause of cervical adenopathy in children. Okay. They're associated with symptom of underlying upper respiratory infection. Most common viral agent dia adenovirus, adenovirus, enterovirus. Okay. Dia usually akan, the reactive lymph node ni akan regress in 1 to 2 weeks. Okay, the management dia macam ni, dia basically inflammation ni. The management of reactive viral lymphadenopathy is usually observation je. However, kalau neck mass dia larger than 1 cm, should be considered and warrant further investigation. If it's remain for more than 4 to 6 weeks or increase in size, if the suspected adenopathy persists, biopsies can be taken to search for other causes such as fungal, granulomatous or neoplastic processes. Sebab tu usually kalau in children kita expect dia regress in 1 to 2 weeks kalau kita macam inflammatory. Tapi kalau dia dah lebih pada tu, kita start suspect benda lain lah. Alright, itu je. Okay, so midline sikit je. Midline tak banyak sangat. So first is thyroid ataupun nodule mass. So clinically, palpable nodule are seen about to 4 to 7% of people. Okay. About 5 to 10% of nodule may be malignant. Okay. Dia akan increase kalau patient tu pernah receive radiation in childhood. Okay. Incidence of thyroid nodule being malignant also increase if patient over the age of 50 to 60 years old lah. Okay. Ni dia punya high risk for malignancy. Ni ada risk dia. Tak apa ni boleh baca ni. Okay. So a primary thyroid tumor manifests in the anterior compartment of the neck. A thyroid mass in the patient with hoarseness and a history of neck irritation should be considered malignant. Okay, so kita do ultrasound, thyroid scan, thyroid function test. Okay, kita kena consider sebab when allowing the positive for thyroid lesion ni, FNA provide the most diagnostic information in the evaluation of thyroid mass. Okay, so FNA lah. The treatment should be based on a histological finding. Okay. So ni thyroid nodule. Kita buat FNSC, find the aspiration cytology. So kalau malignant ni basically apa approach kita lah kan. So kalau malignant of course lah surgery. Kalau benign kita ultrasound dulu. Ni tak apalah, ni boleh tengok sendiri kot. Kalau suspicious pun kita surgery juga. Kalau inspection veteria kita repeat FNSC tu. Okay. This is the chart flow dah. Okay. So thyroglossal duct apa ni? Apa benda ni? Cyst, okay. Thyroglossal duct cyst ni, dia cover benda ni. Okay, dia usually rounded with diameter of 2 to 4 cm. Okay, dia akan increase in size with URTI. Sometimes they akan present as draining sinus if it has burst due to infection or surgically drained. So ni nampak ni dia punya swelling dah. Because dapat the midline. Okay, so because of the attachment of thyroglossal duct to the foramen cecum at the base of the tongue, it move with tongue protrusion. Okay, tu dia punya clinical sign lah. During development, thyroid enlarge start at the foramen cecum, passes to the base of the tongue and then descend in front, behind or through the hyoid bone to form the thyroid gland. Thyroglossosis can occur anywhere in the course of thyroid duct. Okay, rarely carcinoma develop in the cyst. Treatment dia complete surgical excision lah. Alright, okay. So ni dermoid cyst. Okay, dermoid cyst ni dia basically boleh bagi kepada 3 lah. Epidermoid, true dermoid cyst ataupun teratoid cyst. Yang paling common sekali epidermoid cyst ni lah. Okay, ni tak apa, ni tak ni sangat. Ranula is a mucous extravasation cyst involving the sublingual gland. Ranula ni basically kalau dia punya sublingual gland dia tu damage ataupun ada leaking, dia boleh accumulate fluid. So dia akan jadi macam ni, ranula. Dia dekat bawah tang. Tapi kalau besar sangat dia boleh nak protrude dekat ni lah, bawah ni macam ni. Okay, so ranula present as a swelling of connective tissue consenting of colitic mukin from ruptured salivary gland caused by local trauma. Usually locational lateral to the midline sikit. Ni macam ni nampak tak nampak lateral pun, nampak macam tengah kan. Kalau macam ni ialah sebab ini dia sebelah ni ya. Ni nampak ni penuh. Selalunya presentation dia patient tu dia punya lidah terangkat macam ni ya. Okay. And then radiation associative lymphedema ni dia boleh jadi from two causes lah. Dia caused by removal ataupun damage to the lymph node. So basically kalau macam ada damage tu can be from radiation, and then removal tu maknanya from head and neck surgery lah kan. So basically kan kita ada macam basically a chain of lymph node dekat kita punya neck. So kalau ada salah satu tu damage ke atau sumbat ke apa ke, lymphatic drainage kita dia akan tersumbat lah, dia akan obstruct, and then dia akan lymphatic drainage tu tak boleh nak keluar, tak boleh nak drain well. So dia akan accumulate lymphatic punya drainage. Tu yang dia cause this swelling. Okay. So the common in patient who undergo head and neck surgery ataupun radiation therapy. So feature dia doughy and diffuse swelling of the neck. This may be more pronounced over an incision or in the area under the chin. Okay, so can cause changes in voice, difficulty swallowing, sense of something being stuck in the back of the throat, and in severe cases, they boleh cause difficulty in breathing. Sometimes boleh cause problem with visions as well. Okay, they can have both internal and external area involved. Chronic lymphedema can lead to worsening inflammation and permanent fibrosis to the tissue, leaving them stiff or even woody in texture. Okay, so itu je midline mass. For lateral banyak sikit. Kita ada inflammatory dengan non-inflammatory. Okay, so kita go first sekali malignant lymphadenopathy. So 75% of lateral neck masses in patient older and 40 years are caused by malignant tumors. Apa hal 75%? Tadi kata 80%. So in adult, a lateral neck lump, even cystic pun should be considered malignant unless proven otherwise. Okay, so in malignant lymphadenopathy, the features can be hard. It can be cystic, but usually hard lah kan. Okay, investigation. Sabar. Investigation usually kalau neck mass ni, sebab kita kan consider the malignant nanti provider kan. So usually my investigation dia FNNC dengan MRI lah kan. Okay, so for confirmation diagnosis, open biopsy of the primary site. Okay, ni tak apa. Ni tak penting sangat. Biarlah ni. Alright. Okay. So and then branchial cyst. Branchial cyst ni basically is a congenital cyst. Yang ni yang saya cakap tadi. Dia masa dia muda dia tak ada masalah pun. Tapi bila dia jadi young adult, baru dia start jadi problem. So it's a congenital cyst due to failure of involution of the branchial cleft during embryonic development. Okay, so masa dia budak dia macam tak detail. Portion of the cleft fail to involate completely. The entrapped remnant form an epithelial line cyst with or without a sinus tract to the overlying skin. Okay, dia usually akan macam triggered masa young adult in the second decade of life. The sudden onset, often after URTI, okay, a tender oval mesh which is declared to be 4 to 6 cm size, smooth, round and fluctuant. Okay, and then location is in the upper neck, okay, anterior to the sternocleidomastoid. So the anterior to sternocleidomastoid ni, sternocleidomastoid dia. Ni dia punya upper neck. Okay, nampak ni mesh dia. Investigation dia US imaging and FNAC. Guys, US imaging ni berapa? Ultrasound kan? Okay. Treatment if acute infection, kita bagi
Umasai.
bukan. Antibiotic followed by surgical excision along with extract if present. Okay. Nampak. Tu branchial cyst lah. Alright, and then cystic hygroma. Okay, cystic hygroma ni usually congenital lah. The fluid filled sac due to obstruction of the lymphatic system. The jugular lymph sac. 90% are seen before 2 years of age, grow as the child grows. Region dia mostly supraclavicular region, okay, the above the clavicle. Can extend to whole of posterior triangle or axilla and mediastinum. Other side dia groin tongue and floor of mouth. Feature dia soft, cystic, multilocular, partially compressible and transluminant. Okay. So treatment dia surgical excision, preservation of neural and vascular structures. Recurrence dia 5% if whole tumor is removed macroscopically, but it is 50% is some part of left. So dia boleh jadi recurrence. Okay, next is carotid body tumor. Okay, carotid body ni dia apa? Dia chemoreceptor dekat bifurcation of the common carotid artery. Ni common carotid artery ni bifurcation dia kan. Carotid body ni function dia apa? Dia apa? Dia regulate pH PCO2 dengan PO2. Tapi dia boleh jadi tumor. Cuma dia punya feature dia very slow growing tumor. Dia pulsatile, dia boleh ada bruit and the painless swelling. And it also can move from side to side. They may extend into the parapharyngeal space and present in the oropharynx. Okay. For investigation dia kita do contact and sun CT and MRI with gadolinium. Okay, diagnostic and show the extent of the tumor. Okay. Tak apa. Alright. Okay. So treatment surgery
Okay.
if patient surgically fit and based on being symptom difficulty in speech, swallowing and reading and radiotherapy. Okay. Next. Okay, ni patient yang with the carotid body tumor. Ni MRI angiography dia. Okay. Apa? Ni saya tutup benda apa. Alright. So next is lipoma. Lipoma ni dia benign soft tissue tumor. The soft mass usually presenting in the fourth decade, asymptomatic, soft to touch and deep to the skin. Occasionally can grow very large and deeply seated between muscle and nerve. Investigation dia FN or MRI. Kita treat dia kalau usually for cosmetic reason lah, ataupun kalau dia besar sangat ke apa kan. Kalau patient rasa tak selesa ke apa, kita buang lah. Tapi dia benign lah. Okay, and then neck abscess and parotid swelling. So basically abscess ni dia sebab dia ada space lah usually. Kalau macam parotid abscess ni sebab kat parotid space. Ludwig angina abscess pula usually sebab dekat submandibular space. Nanti kita tengok lah peritonsillar abscess ni dekat peritonsillar space. Sama je, semuanya basically ada space. So ada infection kat situ, collection of pus jadi abscess. Okay. So kita tengok. So in parotid abscess, okay, definition dia suppuration of the parotid space. So kat mana parotid space ni? First kali kita the deep cervical fascia kita boleh divide dia kepada superficial fascia. So and then deep fascia kan. Jadi parotid space ni dia duduk dekat superficial fascia. Okay. Ni tak apalah, ni tak kisah. Oh, dia highlight. Okay, tak apa. So etiologi dia dehydration, particularly in post-surgical cases and debilitated ataupun weak patient with stasis of the salivary flow in the is the predisposing cause. Okay. So infection from the oral cavity also can travel via the Stenson duct. So Stenson duct tu dia connect daripada oral cavity tu ke parotid space tu. So dia boleh juga carry infection. So multiple small abscess may form in the parenchyma and may seen coalesces to form a single abscess. Okay. Common organism yang cause the infection is Staphylococcus aureus. Tapi boleh je jadi Streptococci, gram-negative organism. Okay. Okay. So clinical features dia ada swelling, redness, induration and tenderness. Induration ni apa? Macam dia mengeras lah. Dia macam fibrosis. Dia jadi macam stiff. In the parotid area and at the angle of mandible. So usually the unilateral, but bilateral abscess may also occur. Fluctuation is difficult to elicit due to thick capsule. Okay. Opening of the Stenson duct can become congested and may exude pus on pressure over the parotid. Usually patient is toxic, running high fever and dehydrated. So kalau nak diagnose, kita kena do ultrasound or CT scan. More than one localized opus may be seen. Aspiration of abscess can be done for culture and sensitivity of the causative organism. So treatment dia, first kali kita correct the dehydration, improve oral hygiene, promote salivary flow and start intravenous antibiotic. And then surgical drainage under local or general anesthesia is carried out by preocular incision. So preocular incision. Ni yang standard, ni ada facelift, ni parotid mini incision, dia ada banyak jenis lah. Tapi yang paling bagus incision sebab dia smaller incision and faster recovery. Yang ni lah, this one. Sikit lah. Okay. Okay, ni tak apa, ni tak penting pun. Alright. So, Louis angina, nama macam fancy kan. Tapi dia basically sama je macam parotid abscess ni. Dia basically infection of the submandibular space. Ataupun kita boleh je panggil dia submandibular abscess ke apa kan. Tapi Louis angina. So, first kali submandibular space ni simple lah. So, tongue ni tongue kita kan. So, below the tongue and above the mylohyoid ni bone ni is submandibular space. Tapi submandibular space ni kita boleh divide dia kepada dua, which is kita bahagi dia dengan mylohyoid muscle ni. So mylohyoid muscle ni yang belah atas tu kita akan panggil compartment dia, kita panggil submylohyoid space. Yang atas sublingual space, yang bawah submylohyoid space. So ni submylohyoid space, ni sublingual space. Tapi overall dia is submandibular space lah kan. Okay. So this one usually dia caused by dental infection, which is kita punya molar dengan premolar tooth. So kalau account for 80%, dental infection account for 80% of the cases. Root of premolar, dia usually dia duduk dekat atas attachment of mylohyoid dan dia akan cause sublingual space infection. So sublingual space infection kat atas ni. Ni root of premolar. Tapi kalau molar punya tooth, dia punya root dia extend until below the root of the molar teeth extend up to or below the mylohyoid line and primarily cause submaxillary space infection. Okay, submandibular okay, dia tak ada apa. Okay. And then usually clinical features dia, there is a marked difficulty in swallowing with one degree of trismus. Trismus ni susah nak open the mouth kan. This is my problem ni. And then when infection is localized to the sublingual space, structure in the floor of mouth are swollen and tongue seem to be pushed up and back. Okay. So when infection spread to the submaxillary space, submental and submandibular region become swollen and tender and impact the heart field. Usually there is a lattice of the tissue rather than frank abscess. Tongue is progressively pushed upward and backward, threatening the airway. Laryngeal edema may appear. Okay. So treatment dia systemic antibiotic and then kita do incision and drainage lah. Okay, intraoral if infection still localized to sublingual space. External if infection involve submaxillary space. Okay, tak apa. Ni too detail lah. Kalau airway dia obstructed ke apa, kita do tracheostomy. Okay, so peritonsillar abscess. Belakang ni para pharyngeal space. Kalau peritonsillar abscess ni dekat peritonsillar space. So dia just belakang ni lah palatal tonsil ni. Ni capsule kan. Ni yang black ni, hitam ni space dah. So dia usually follow acute tonsillitis. Sekarang ni kalau macam cedera, dia orang yang usually have acute tonsillitis kan. Tapi peritonsillar abscess ni dia common in adult rather than children lah. Adult yang ada acute tonsillitis ni dia akan have more risk to get peritonsillar abscess. Okay. Usually boleh jadi Streptococcus pyogenes, Staph aureus, okay, tak apa. And then yes, peritonsillar abscess mostly affect adult and rarely in the children. Walaupun acute tonsillitis ni more common in children, okay. Usually it is unilateral, though occasionally it can be bilateral abscess. Okay. Clinical features dia generally they resemble any acute infection, fever, and for Fahrenheit ni berapa? 40 Celsius 39. Chills, anger, general malaise, body ache, headache, nausea and constipation, okay. Locally severe pain in throat, usually unilateral. Usually they also correspond to the abscess kan. Kalau abscess dia ada dekat both side of dia punya tonsil, peritonsillar space, mana nampak dua-dua ada swelling, of course lah pain dia type unilateral. And then odonophagia, okay, muffled and thick speech, hot potato voice, okay, foul breath due to sepsis, ipsilateral AH, trismus. Okay. So the tonsil, pilar and the of palate on the involved side are congested and swollen. Tonsil itself may not appear enlarged as it get buried in the edematous villi. Okay. Ovula is swollen and edematous and pushed to the opposite side. Okay, bulging of the soft palate and anterior pillar above the tonsil. Okay, tak apa-apa. Okay, cervical neuropathy is commonly seen. Torticollis, patient keep the neck tilted to the side of the access. Torticollis ni dia macam nak? Dia hyperextended neck kan? So,
Dia
yalah.
bukan hyperextended, dia macam tip the neck to one
Macam nak?
side.
Oh, dia macam ke kiri atau ke kanan macam tu
Kepala sengit
yang hyperextended neck tu apa nama dia? Lain Apa? Tak ingat.
Tu I don't know.
Okay, tak apa-apa. That's right.
Tu
So,
Tu meningitis tak?
tak lah. I mean, medical term for hyperextended neck. Tak apa-apa. It's alright. Kita sambung dulu. Sorry, saya just check dia punya term tak jumpa apa. Tak apa. Okay, so complication of acute tonsillitis ni standard lah, fever, sore throat, muffled voice, drooling, trismus. Trismus?
Dia bukan hyperextended neck. Dia
Trismus bukan susah nak open.
Trismus
Susah.
susah open.
Trismus is my issue yang saya kadang-kadang tak boleh nak buka my jaw.
Ya ke? Macam ada makan burger?
Hah?
Burger boleh makan?
Tak, bukan. Syafiq tak tahu Daniel tahu kan yang ada cerita I usually bangun pagi I have a lot of saliva produce. And then sometimes I have problem opening my mouth untuk makan lah, very painful. Sebab
TMJ kan?
TMJ, ada TMJ issue. So I have trismus lah, sometimes. I tak tahu, dia tak ada information pun, tapi sometimes I can ada trismus. Macam nak makan very very painful sampai macam tak boleh makan. Opening tu very small, just maybe one finger boleh masuk.
Okay.
Alright, it's fine. Okay, so palatal abscess ni tak ada apa lah. Cuma deviation of the alveoli ni kalau jadi unilateral lah. And then also can have cervical lymphadenopathy. Okay.
Femet penting
Infemat penting
sebab itu doktor tanya juga. Lepas tu sign symptom dia kan ada hot potato voice kan.
Siapa faham sikit hot potato voice ni macam mana sebenarnya?
Tu lah muffle speech. Dia yang macam kau makan kentang yang panas. Tak boleh
Macam tu.
Macam tu lah.
Faham lah. Macam tak semesti kentang kan. Macam apa-apa benda yang panas lah kan.
Macam nugget
Atau macam
pizza.
protein panas pun boleh ke?
Usually yalah macam ni lah. Cek Mac molek yang dalam gula dia kan panas. Kita makan acar sejuk.
Ni kopok leko panas.
Macam cukodok.
Dah. Lapar tu dah. Okay, so tapi lagi. Treatment dia hospitalization, IV fluid untuk combat dehydration and antibiotic. Also boleh bagi PCM untuk relief pain, lower temperature sebab kan dia associated with acute tonsillitis kan. So kalau dia ada fever, of course lah bagi PCM. Okay, oral hygiene, okay, and then above conservative measure may cure peristaltitis, tapi if a frank abscess has formed, incision drainage will be required. Okay, incision drainage lah. Alright, next retropharyngeal abscess. So retropharyngeal abscess ni dia also related dengan dia boleh terbagi kepada dua lah, sebab kita ada retropharyngeal space dengan prevertebral space. Basically retropharyngeal space ni is the space between the pharyngeal constrictor muscle and prevertebral fascia. So ni vertebra kita kan, tulang belakang. Anterior to it is the prevertebral fascia yang orange ni. Dan yang hijau is the pharyngeal constrictor muscle. So ni the whole thing ni is the space lah. The space of the retropharyngeal. Dia extend daripada base of skull, ni base of skull dari sini. Boom sampai bawah to the bifurcation of the trachea. Okay. So the space divided into two lateral compartments, space of Gilead. Okay, tak apa, tak ada benda. Okay. So each lateral space ni dia boleh they usually disappear 3-4 years ni. Tak penting sangat lah information ni. Okay. Tapi yang pentingnya pharyngeal space communicate with the retropharyngeal space. Fraction of retropharyngeal space ni can pass down behind the esophagus into the mediastinum. So esophagus tu dekat sini kan ni. Ni esophagus, ni space tu. Ni space, ni esophagus yang kecil tu. So infection dia boleh pass down to esophagus dan dia boleh pergi masuk dalam mediastinum kita. Okay. Ni prevertebral space pula. So basically prevertebral space ni dia belakang retropharyngeal space tadi. Nampak ni kan retropharyngeal space kan. Ni prevertebral fascia kan yang oranye ni kan. So between prevertebral dengan body of the vertebra ni is the prevertebral space. Okay? Faham tak? Faham kan? So it lies between the vertebral bodies posteriorly and prevertebral fascia anterior. Okay. So sama juga they extend tapi dia lagi jauh lah. It extend from the base of the skull to coccyx. Sebab apa? Sebab yalah space between vertebra dengan prevertebral fascia. So mestilah sampai ke bawah sini kan. So abscess of the space produces midline bulge in contrast to abscess of retropharyngeal space which causes unilateral bulge. Okay, to beza between prevertebral abscess dengan retropharyngeal punya abscess. So, etiology dia commonly seen in children below 3 years old. Okay, it is the result of suppuration of retropharyngeal lymph node secondary to infection of the adenoid, nasopharynx, posterior nasal sinuses or the nasal cavity. In adult, it may result from predating injury of posterior pharyngeal wall or cervical esophagus. Ni we talking about acute retropharyngeal punya abscess lah kan. So clinical features apa hari tambah ni? Dysphagia and difficulty in breathing. Okay, stridor and croupy cough. Croupy cough ni apa? Macam kalau croup kan ada bark cough kan. So macam barking cough. Torticollis. The neck becomes stiff and the head is skewed as an ni ini yang saya cakap the hyperextended tu. Supaya dia tilted to the side. Memang sekejap saya boleh check definition
Of the affected side.
The neck becomes stiff and the head is extended to the affected side lah.
Dia bengkok ke affected side.
Dia bukan hyperextended ke depan lah.
Dia bengkok belah affected side. Bagi aku kalau common sense dia tu sebab kau punya infection bulging tu ke tengah kan. So maybe dia tak nak put pressure.
Tapi kalau dalam ni lah, tak adalah definition. Tapi kalau macam kau quick Google kan, dia cakap torticollis ni a problem involving the muscle of the neck that causes the head to tilt down. Sebab tu aku cakap dia tadi, dia hyperextended neck. Tapi I guess sebab tadi pun dia guna torticollis for neck yang tilted to affected side kan. So maybe dia basically tahulah. Nantilah kita cari dia punya definition ni. Kalau ada nanti aku post.
Macam tortilla.
Tortilla chicken wrap lah. Okay. Alright. Kat mana tadi? Alright. Okay. Tak apa. Bulge in posterior pharyngeal wall usually seen. Apa hal ada hitam ni? Sekejap. Apa benda ni?
Grafik kat barai. Kau kena tukar grafik.
Oh dia tak ada. Alright, whatever.
Dia kena take away.
Tak boleh.
Bulge in posterior pharyngeal wall usually seen on one side of the midline. Okay. Okay, tak apa. Sebab ni kan retropharyngeal space kan. So dia boleh ke tepi sikit. Kalau prevertebral punya space tu dia memang kat tengah-tengah. So treatment dia incision drainage. Okay. Tapi usually done without anesthesia as there is a risk of rupture of abscess during intubation. Child is kept supine. Okay. Mouth is open with gag. Vertical incision. Okay. And then kita buang lah dia punya pus. Okay, systemic antibiotic and then kalau dia block airway kita tracheostomy. Okay. So in chronic retropharyngeal abscess, it is tubercular as a result of, okay, dia boleh jadi dua sebab lah kalau chronic ni kan. Kalau ni macam ni acute infection. Kalau chronic ni satu maybe dia boleh jadi sebab TB, spinal TB. So kalau patient tu kita kalau dia ada spinal TB can have chronic retropharyngeal abscess. Satu lagi caries of cervical spine. Caries ni maksud dia macam degradation ataupun decay tentulah of the cervical spine itself. So dia punya produk dia tu ni lah, chronic retropharyngeal abscess. So clinical features dia, patient may complain of discomfort in throat, dysphagia, though present is not marked. Okay, posterior pharyngeal wall show fluctuant swelling centrally or on one side of the midline. Neck may show tuberculous lymph node. In cases with caries of cervical spine, X-ray are diagnostic. Okay, sebab daripada X-ray tu kita boleh nampak degradation of the cervical spine tu kan. Okay, so for treatment dia depends lah. Kalau patient tu from spinal TB, kita kena guna full course of anti-TB therapy dulu. Tapi kalau patient tu tak sabar. Sebenarnya kita incise dulu kan, buang drainage tu. And then kita bagi dia anti-TB therapy lah kan. Tapi patient tu kalau from caries of the cervical spine, maknanya kita just do INU lah. Okay, parapharyngeal abscess. Okay, dia basically ingat tadi peritonsillar abscess kan. So dia belakang. Oops, sorry, screen tertutup. Okay, dah sambung balik. So dia dekat parapharyngeal space. Tapi kita bagi dia kepada dua kompartmen lah. Satu anterior compartment and then satu lagi posterior compartment. Apa yang penting dia, anterior compartment ni dia related back sebab dia anterior kan. Anterior. Ni nak faham tak ni? Ini transverse punya section. Maknanya kita potong kepala ni kat sini. Okay, boom. Cabut kepala dia, kita tengok pada atas. Kan? Ni teeth lah kan. Okay, so anterior compartment dia dia related to the tonsillar fossa medially and medial pterygoid muscle laterally. Of course, kalau dia abscess tu ada dekat sini, sebab dia affect pterygoid muscle ni, boleh jadi trismus lah kan. Okay, also kalau ada abscess tu, of course, dia boleh buat nampak swelling lah kat sini. Okay, posterior compartment pula related to posterior part of lateral pharyngeal wall and also the parotid gland laterally. Okay, so kat situ juga dia ada carotid artery, jugular vein, and then nerve 9 and 10, nerve 11, nerve 12, cranial nerve and sympathetic trunk. Jadi maknanya kalau ada abscess kat situ, dia akan boleh affect this nerve. Okay, so etiology dia, infection of the parapharyngeal space can occur from pharynx. Okay, acute chronic infection, tonsil adenoid. Okay, tak apa, teeth, dental infection, last molar tooth sebab dia belakang tu kan, nampak last molar tooth daripada sini lah. Okay, other spaces at ear, basal abscess and petrositis. Okay, other spaces, infection of the parotid. Kalau parotid infection, dia boleh pula masuk balik dalam parapharyngeal abscess, especially kat posterior compartment lah kan. Sebab dia related back to the parotid gland. Okay, and then, apa lagi? Retropharyngeal and submarin space. Dia make sense lah. External trauma, penetrating injuries of the neck, injection of local anesthetic for tonsillectomy or bular nerve block. Okay. So, parapharyngeal abscess, clinical features dia, kalau anterior compartment, dia ada triad of symptoms. Okay, 3. Prolapse of tonsil and tonsillar fossa, trismus due to spasm of the medial pterygoid muscle and external swelling behind the angle of jaw. Okay, and then kalau posterior compartment, bulge of the pharynx behind the posterior pillar. Okay, paralysis of nerve 9, 10, 11 and 12 and sympathetic chain. Okay, swelling of the parotid region. So they always related back to the anatomy lah. Jadi bagi faham itu. So fever, odinophagia, sore throat, torticollis ni tadi due to spasm of preventricular muscle and sign of toxemia are common in both compartment. Okay, so treatment dia antibiotik dengan INU lah. Habis. Alright, itu je lah. So tak detail sangat presentation ni, but basically I just want you guys to faham lah kan apa benda abscess ni, dia back to the space. Dia simple je sebenarnya. Lepas tu rasanya semua okey kot. Macam tak ada apa sangat. Okey tak? Ke macam kurang?
Tapi actually torticollis apa benda kan?
Kita tengok sikit tu.
Dia sebenarnya macam Ninja Turtle. Collie.
E. coli lah. Kira dia kena infection of E. coli.
Sabar guys. Dia just abnormal asymmetrical head or neck position. Dia may due to variety of cause.
Boom.
So dia tak semestinya tilted to the left right. Dia boleh jadi any abnormal neck position is torticollis lah. Boom.
Boom.
Tapi tadi dekat dalam Quincy kenapa dia cakap dia tilted to the affected side?
Dia okay, first kali torticollis tu is abnormal neck punya orientation kan. Dia tilted to the affected side. Tilted opposite ke to the affected side?
Affected.
To the affected side.
Takkan tak sakit. Ingatkan kau opposite. Kalau opposite sebab sakit kan.
Tapi
Salah?
bagi aku, kenapa jadi macam tu kalau common sense aku lah. Itu common sense aku kot.
Common sense ni sebab apa? Sebab kalau macam
Tak nak
logically
sakit lah.
tak nak sakit. Bukan kalau
Sebab-
kita tilt dekat affected lagi sakit ke? Sebab kita macam put more pressure.
Tapi kalau perasan, kita stick to affected side. Bulging tu dekat tengah-tengah tau. Faham tak aku?
Ni yang tadi.
Ah.
To the side of the abscess.
Cuba hang rasa lah hang ada bulging kat
Okay.
tekak tau. Tapi
Dekat
kau tick
right.
kat affected side. Dia tak put pressure lah kiranya.
Oh lah nak.
Tak tahu. Kena ada
Tapi-
lu benda tu bau tau.
Tu lah, tak pernah dapat
Baru hang
apa.
tahu dia je lah. Baru hang-
Bagi mana dia ada punya etiologi, tengok sikit bagi Syafiq dapat malam ni. Define. Tak lah. Ni dia tilted. Nanti kalau kita jumpa ORL specialist, kita tanya balik lah. Torticollis ni apa actual definition dia ni sebenarnya?
tu tadi yang baby merah.
Mana?
Baby
Ni.
merah. Tu.
Neck or collar. Torticollis is a symptom related to turning or bending of the neck kot. Dah tak pernah.
Dah tak payah.
Alright.
Alright.
Okay.
Okay.
Beres-beres.